I think the least helpful advice is just chill out, just relax. If you weren't so stressed, then this would happen more easily. There is really no evidence that being stressed is causing infertility. There, however, is evidence that if you're stressed during treatment, you have a higher rate of treatment dropout. So giving up on your treatment before it was successful when it might have been successful. And a woman named Ali Domar published really extensively on this about how can we support people through IVF so that they can continue in treatment and ultimately be successful. One of the really common misconceptions is that IVF, I'm just going to do IVF. I didn't want to do IVF, but I'm going to do it and it's going to work. IVF works often, but it doesn't always work on the first time. And so it's important to have realistic expectations. But if you get stressed to the point of, I can't continue with this treatment, then that could be harmful. But don't tell people your infertility is a result of you not trying hard enough. So infertility is a medical disease and we need to approach it that way. And I'm really happy to see increased insurance benefits and acknowledgement of this as a disease so that patients can get the care they need, but it's really not because they're stressed out. But you telling them that is going to make them more stressed, and that's not going to be good for their treatment. Whoever is going through the treatment needs really emotional support and just kind of a rock to lean on. For some people, that might be giving their injections every day. For other people, it might be just managing the medicine calendar. I think when you're going through IVF, there's a lot of moving parts. And if you're doing it alone, it can feel really overwhelming. So I would encourage you to start by asking your partner, what do you need? What works for you? Some people like to have control, manage the calendar, manage the medications, give all their own shots. And other people really, because they're maybe overwhelmed by the medical experience, want their partner to take on, say, the medication management, or the ordering of the medications, or the price shopping, or the mixing of medications, or maybe I can handle subcutaneous shots, but I want you to do the intramuscular shots. So I would encourage you to check in with your partner. And I would also say for women who have a male partner with a diagnosis of male factor infertility, just being really sensitive to the fact that that can have a stigma too, and that can have emotional consequences as well. So this is something that should go both ways for sure. I would really encourage people to look for support groups that focus on really emotional support or providing evidence-based tips. There's a lot of online support communities that can be really good, but can also provide false information. And I like to tell people that your physicians went through 4 years of medical school, 4 years of OBGYN residency, and 3 years of subspecialty training in infertility and IVF. So 11 years after college to learn how to do this specialty. So anecdotes that people post online might not be the best way to get your clinical information, and it can actually lead to a lot of confusion. So I think support groups, if it's emotional connection, community, there's no doubt those play a really important role. It's always a good idea to check with your clinic. And one of the things I'm really proud of at CCRM is that we have on-site support. We have licensed clinical social workers that work with our patients and run support groups on the various things that our patients might be going through. Recurrent pregnancy loss, secondary infertility, getting pregnant after fertility and what that's like, because it might not be as smooth or anxiety-free of a pregnancy as they would have hoped. So I would check with your local clinic and see what they offer. And organizations such as Resolve and the American Society for Reproductive Medicine have really evidence-based approaches to support. And again, different things work for different people. So finding community is one thing. And if you're looking for support and answers, talk to your physician and see how they can guide you.